So this is a video that I would like to make trying to explain calcific tendonitis, right? So calcific tendonitis is an interesting phenomenon in the shoulder where you develop tendonitis. And tendonitis is, if you break it down, right, so you have a tendon, right, which all of our muscles become tendon, which then insert into bone, right? So if you look at this model right here, this red is the muscle, and this white is the tendon, and then this inserts into the bone. So when we say tendonitis, we're saying that the tendon is inflamed. Itis is inflammation. So what happens in some patients, so we're not totally sure why this happens, but it does happen fairly frequently, is they develop tendonitis in the rotator cuff muscles, and then they lay down these calcium deposits in the tendon. And it's actually inside the tendon. It's bright white calcium. And it's very painful. Typically when someone comes into my office, no history of trauma or injury, and they just have this rip-roaring acute onset of pain and inflammation in their shoulder, one of the first things that pops into my mind is calcific tendonitis, because it can be very painful. And so you develop tendonitis, you put, the body puts calcium or lays calcium down into the tendon, and really it's almost like your body reacts like it's a foreign body or almost an infection, really, in terms of how intense the pain is. Now that's not all patients, but many come in with a very painful shoulder. So you have tendonitis, there's calcium in the tendon. What do we do about it? Well, we almost always start with a cortisone injection and physical therapy. Sometimes, I use ultrasound for the majority of my injections, or pretty much all my injections in the office, for various reasons. Number one, just accuracy. Number two is decreased pain because of the accuracy. And so what we do is we inject cortisone right around the calcium deposits, and sometimes we try to take that needle and try to flex some of the calcium out of the tendon, and then get you into a therapy program. And across the board, we've got about a 90% success rate with doing an injection and therapy to fix the problem. If you fail that, right, meaning that you still have significant pain despite injection and therapy, then typically we recommend an operation, which is going in and removing the calcium out of the tendon. So we go in arthroscopically, and imagine if this tendon right here had a large amount of calcium. What we have to do is actually kind of lift up the tendon, clean up the calcium, and then we actually have a little hole that we've got to patch. And so we use these little anchors right here to re-repair the tear that we've essentially had to create in order to get the calcium out of the tendon. Anything else that's wrong in your shoulder we would fix. Highly successful operation, 95% success rate for that operation in our practice, but we still try to avoid it, and we can in most patients with an injection and physical therapy. Other things about calcific tendonitis that I've seen is, if you've had calcific tendonitis for a couple of weeks, right, your chances of that going away are relatively high. When I see someone who comes in and they've had calcific tendonitis for 2 or 3 years, right, where either it was diagnosed prior or we've been following them, the chances of that going away are pretty low. They're pretty low. So, and also what I've seen is the amount of calcium. If you've got this huge, massive deposit in there, those don't tend to go away with conservative treatment, whereas small little flecks have a higher success rate. But I've seen it go both ways. I've seen fairly large deposits get better with physical therapy and injections. I've seen smaller ones end up having surgery. So it's not quite that simple. But we start with conservative treatment in almost everyone and see where we can get. And if we fix your shoulder with an injection therapy, then congratulations, that's awesome. If you're still having a lot of pain, just know that the operation, even though it is a surgery, does have a very high success rate at fixing the problem. And either way, when you have this problem, it's something that we can solve with either one of those methods. So that's how I think about calcific tendonitis. Another question I get from patients a lot too with this is does the calcium go away? And sometimes it does, sometimes it doesn't, right? We're not really concerned about the calcium in the tendon. We're concerned about your pain and restoring the function of your shoulder. And really, I think of it as like almost a rotator cuff tear, because when that calcium is in your tendon, that inflammation kind of shuts down the muscle. And it doesn't allow your rotator cuff to function optimally. So we've got to get the inflammation down, get the strength back, and get the stability in your shoulder, and get the rotator cuff functioning. Most of the time, thankfully, we can do it with therapy, but sometimes it does require an operation to fix this problem. So very common, very interesting problem, honestly, but something we can solve pretty consistently.